To start with, the last fat soluble vitamin, vitamin K. K is found in three forms: K1, K2 and K3. Piloquinone, naptoquinone and menadione or minaquinone. Now, this menadione is an artificial form. Fine. Now, have you ever seen anyone is having their parents pediatrician? Anyone? No. Have you heard of giving a vitamin K injection soon after the birth of the baby? Yes or no? No, never heard of. Why? What is the function of vitamin K? Helps in clotting or coagulation? Coagulation, right? So it helps in blood coagulation. So the babies which are born with insufficient hepatic function, three forms: piloquinone, phyllo means plant, it is a plant form; minaquinone or naptoquinone, it is an animal form. Animal form means they are not animals. This form is available in the stored form or storage form of vitamin K within the animal organs. What are the major organs to store? Mostly liver, right? So now, see what is the structural difference between menadione and other two. So it is a water soluble form. Fat soluble vitamin cannot be injected with water, number one, and cannot be injected in water, plasma, correct? So we need the same function but water soluble. So the menadione is an artificial injectable form of vitamin K which is given injection to the newborns who suffer from hepatic insufficiency to produce coagulation factors, right? They cannot produce enough amount of coagulation factor, hence they are given vitamin K injection. Sources: mostly vegetables, fruits and other organ meats. Function: sources. Function: vitamin K has a unique function called co-enzyme activity. Now, by and large, it is considered that fat soluble vitamins can be stored in the body and required, the RDA is very less because they are stored in the body. And water soluble vitamins, on the other hand, since they are water soluble, they are lost every day through urine, so their RDA is higher. Correct? Water soluble vitamins' major function is coenzyme activity, except vitamin K. Vitamin K has a unique coenzyme activity, that is, it acts as coenzyme in gamma-carboxylation reaction. It acts as coenzyme in gamma-carboxylation reaction. What is gamma-carboxylation reaction? We know we have one amino acid called glutamic acid. It contains 5 carbon atom and 2 carboxylic acids, carboxylic group. Now, in the second carboxylic group, the gamma carboxylic group, a new carboxylic group is attached. This process is called gamma carboxylation. So, the alpha carboxylic group participate in the peptide bond formation. Gamma carboxylic group produces a unique property or imparts a unique property to the glutamic acid with 2 negatively charged claw. These 2 negatively charged claw can hold a dication, preferably calcium, which is required for number one, coagulation factor, coagulation process. Number 2, bone mineralization. The first and foremost criteria for bone mineralization is to increase the calcium concentration within the small region of bone tissue, and that is achieved by presence of certain proteins which are specialized to be found in bone tissue, and they are all gamma carboxylated. See, for example, osteocalcin, they are all gamma carboxylated. They can hold calcium ion, and hence the calcium ion concentration increases in a very small region within the bone tissue to produce or to help bone mineralization. Now, this is one of the questions came in this supplementary examination. Which of the following factor is vitamin K dependent? One of the factor has been given. This came as an just now, just one exam got over, same exam. So 2, 7, 9, 10. Remember 2, 7, 9, 10. Try to remember their names also, which I am not going to elaborate here because it's a part of physiology. 2, 7, 9, 10. They are dependent on vitamin K. Why? Because these proteins require gamma carboxylation. These proteins require vitamin K as coenzyme. Now, vitamin K performs a cyclic transformation called vitamin K cycle. This is often asked as a short note. Vitamin K cycle. Vitamin K is first reduced to reduce vitamin K by specific reductase enzyme, correct? And then this reaction takes place. What is this reaction? Gamma carboxylation. One molecule of glutamic acid is converted to gamma carboxylic acid, GCA, gamma carboxylic acid, GCA. Then this process converts reduced vitamin K to vitamin K epoxide. Epoxide means the double bond is joined by attached with one molecule of oxygen, one atom. Then the epoxide reductase enzyme converts it back to vitamin K form. Epoxide reductase converts it back to original vitamin K form. This is called vitamin K cycle. Alright. Now, there are certain compounds which are given as antagonists of vitamin K. These antagonists act at this stage. Epoxide reductase. One of the example is warfarin. What is warfarin used for? That is an effect, but what is it used for? War. Warfarin is used in war as war gas. With bomb, if this gas is dropped in locality, then the people will die due to bleeding, profuse bleeding. You need not to poison them. Whoever will come in contact with the gas will start bleeding and will die. This is a reaction with structure showing gamma carboxylation of glutamic acid. GLA, it is the standard abbreviation of gamma carboxy glutamic acid. Standard abbreviation of gamma carboxy glutamic acid. Now, what are the causes for vitamin K deficiency? Remember, those days are gone when you just read the deficiency manifestation, this, that, no, function, no. Now you must remember the causes. Why? Because sometimes the clinical cases will come depicting these causes. Through these, you have to identify what is the disease, what is the cause. Like power cut. Right? So, what is that? Hepatic insufficiency. Liver cannot produce vitamin K. Vitamin K cycle takes place within the liver. So, in absence of vitamin K, there will be lack of coagulation due to hepatic insufficiency. Use of salicylates, a drug, salicylic acid. If it is given it reduces vitamin K synthesis or vitamin K cycle within the or utilization or production in the body. Coumarin, dicumarol, these compounds, they are called vitamin K antagonists. If the person is having vitamin K excess, then this can be given, correct? If the person is having clotting disorders, then can be given this dicumarol can be given for so that the blood doesn't clot. Okay. Certain drugs like anticonvulsants may lead to vitamin K deficiency. Correct? They act in the liver and they reduce the vitamin K regeneration process. Reduced fat absorption. Can you name one disorder? Disorder name? Creatoria is a symptom. Name of the disease? Obstructive jaundice. Obstructive jaundice. Clear? Creatoria is a symptom. Name of the disease? Jaundice. Although jaundice is called not disease, symptom, but obstructive jaundice is fixed as a disease. It is due to obstruction in the biliary canaliculi. Okay. Last one is lack of vitamin K in the diet. Why last one? Nowadays, we are 4th or 5th largest economy of the world. Hardly we have any person in our country who is not getting food. Right now, we all are overfed. See? Stand up. Stand up. See? Overfed, overfed, overfed. Right? So the first point is quite unlikely to happen. At least to the patient who pays your visit to show you. Right? That means you have to think about these things. Are they taking any drug abuse? Are they taking any other medicines which can interfere? Accordingly, you have to give the supplementation. Correct? Fine. And when will you give the supplementation? We will see. Symptoms in vitamin K deficiency. It is a clotting disorder. It is a clotting disorder. By this time, I hope you have come across the clotting time and bleeding time experiment. So you have an idea what is the difference between bleeding time and clotting time. So if the vitamin K is absent, deficient, which time will increase? Yeah? Clotting time. It's a coagulation defect. So bruising from the under the skin, nosebleeds. What do you call nosebleeds? Epistaxis. Bleeding gums. Very often while brushing, the bleeding will start but it will not stop. Bleeding in stomach, blood in urine, stool, bleeding in stomach. Correct? Sometimes a small ulcer will persist for prolonged period. Blood in stool. Correct? Whatever, if the bleeding is taking place inside the stomach, from where it will come out? To stool. So you check the stool for occult blood, you get the presence of blood. Right? Then if you do colonoscopy and find nothing wrong, then what is there? That means something is wrong up to the stomach. Then you go for endoscopy, find out at what point it is bleeding, what is the cause. This one may be seen among the lower socioeconomic group people, who are not taking proper diet. So, young females may show increased bleeding during menstruation. Infants may show intracranial hemorrhage. Right? Intracranial hemorrhage, because wherever blood vessels are there is a possibility to get it ruptured due to increased pressure, BP. If vitamin K is deficient, then this thing will not be repaired fast. So, bleeding will continue. Right? That's called hemorrhage. Fine. Huh? Tarry back stool. কি বলা হয়? মেলিনা বলা হয়। তো নেক্সট স্টুল, ব্লাড ইন স্টুল। আচ্ছা, ব্লাড ইন ইউরিনকে কি বলা হয়? হেমাচুরিয়া। তাহলে এবারে তিনটে টার্ম আমরা শিখব। In case of vitamin K deficiency, when a person is applied pressure cuff for some time and then released, you find underneath the skin there is spots, not immediately, after some time, it's a couple of hours, some spots. Depending on the size of the spot, it has got three names. Smallest spot, like a size of a pinhead, is called Petechiae. Little bigger, like dots, full stops, called Purpura. And like a patch, it's called Ecchymosis. Three forms based on size of the hypodermal bleeding. See the difference? Petechiae, size of a pinhead. Purpura, little bigger spots. And this is Ecchymosis. Clear? In three ways, patient can show up. All right? Any question from vitamin K? Then note down important question from vitamin K. Vitamin K cycle, vitamin K antagonist, causes for vitamin K deficiency. Huh? Last question ta. Manifestation of vitamin K deficiency. Right? Okay. Now, vitamin B1, the first among the water soluble vitamin. Vitamin B1, always remember these vitamins are always accompanied by their chemical name. The chemical name for vitamin B1 is thiamine, or thiamine, whatever you say, not thiamine. Thiamine or thiamine, but not thiamine. Thiamine or thiamine is found in active coenzyme form called TPP, thiamine pyrophosphate. Thiamine pyrophosphate, TPP. The structure of thiamine pyrophosphate is like this. It contains three parts. One is pyrimidine ring. Second is thiazolium ring and pyrophosphate. Pyrimidine, thiazolium and pyrophosphate. Thiamine, pyrophosphate. It is the active form or coenzyme form of thiamine or thiamine. All right. Chemical function. Thiamine pyrophosphate is required in these three reactions. In these three reactions. All the reactions have been taught to you. And all the reaction comes under carbohydrate metabolism. Number 1, pyruvate dehydrogenase. Number 2, alpha ketoglutarate dehydrogenase. Number 3, trans-ketolase. Pyruvate dehydrogenase comes under pyruvate oxidation. Alpha ketoglutarate dehydrogenase comes under TCA cycle. And trans-ketolase comes under HMP shunt pathway. Okay? Twice, it comes twice in HMP shunt pathway. Fine. So, these three reactions lead to what? The major flux of energy production process. So, in absence of thiamine pyrophosphate, which function is going to be hampered? বল গালে হাতে বসেছিস কেন? থায়ামিন পাইরোফসফেট না থাকলে কি হবে? তোকেই বলছি। What will happen if thiamine pyrophosphate is deficient? What function will be hampered? Energy production will be hampered from carbohydrate. We get our energy from, maximum energy from carbohydrates, from carbs. So, in absence of thiamine pyrophosphate, we won't be able to harness energy from carbs, right? Be attentive. So, lack of energy will be the problem in case of thiamine pyrophosphate deficiency. One more thing will happen. We have two nervous systems, peripheral and central, correct? The peripheral nervous system or nerves are away from the core of the body. They are supplied with less amount of or small amount of blood vessel, surrounded by small amount of tissue. Clear? So, they are more likely to have the immediate nutrition deficiency. Yes or no? Because they are surrounded by less amount of tissue. The tip of the fingertip and the outside of the pericardium, which one is covered by more amount of mass of tissue? So, it is more likely that the nerves or neurons present in the peripheral system, they are more prone to have energy deficiency, correct? Or immediate effect. That's what happened when thiamine pyrophosphate is absent in the diet for prolonged period. The pyruvate cannot be converted to acetyl coenzyme. Hence, T-cell cycle cannot be run. Hence, there will be decrease in energy production. What will increase on the other hand? The pyruvate will lead to production of lactic acid. And this increased amount of lactic acid will push pyruvate within the brain at the peripheral nervous system. And this will lead to peripheral neuritis. Peripheral neuritis. This is one of the probable cause of peripheral neuritis. Not ascertained, but probable cause. Okay, so let's see. আচ্ছা তাহলে তিনটে জিনিস মনে রাখবে। আচ্ছা, now we come to the sources. Sources are unpolished rice or grains. Unpolished rice. Okay. Unpolished rice means nowadays we get rice which are very shiny outside. That means it has been dehusked and then they are polished, passing the rice grains through layers of leather, where they polish the rice and remove all sorts of covering which gives a roughness to the surface to make it shiny. It looks good, tastes good, but lack of nutrients. So, consumption of whole grain is advised. Consumption of whole grain. Before the before the British's time, we used to have all hand pound rice. We never used to have thiamine deficiency. Consumption of unpolished rice increases the risk of thiamine deficiency from the diet. Then what else we can get thiamine from? We can get thiamine mostly from the whole grains. But there are other some, like if you take some amount of vegetables and fruits and all, then also we'll get some amount of thiamine. Correct? How much thiamine do you require? Milligram per day. Remember, all water soluble vitamin a day is between 1 and 2 milligram per day, except only one, B12. All are in milligram per day, and that is also between 1 and 2. So if you forget also, you just write 1 to 2 milligram per day, 1 to 2 milligram per day, you will get marks. Huh? Except B12. B12 in microgram. Now, causes for thiamine deficiency. One of the major cause is eating raw fish, like sushi. They eat uncooked fish. Now, and underneath the scale of fish, there is an enzyme called thiaminase. This thiaminase enzyme, if the fish is not cleaned properly, skin is not removed properly, I tell you why sushi is not harmful. Because for preparation of sushi, the first criteria is it has to de-skin. Okay? And thiamine is present in skin of the fish. Okay? So sushi is fine to take anyway. You like sushi? Anyone? No one likes sushi here. Huh? No one? Huh? You like? You like sushi? Louder. Oh, you ate it, but you didn't like it. Fine. Okay, fine. It is very good if you prepare properly. Anyway, very tasty. Yeah. Why should take always Bengali means aloo posto? Why can't Bengali have something else? Next important cause for deficiency of thiamine pyrophosphate is chronic alcoholism. Why? You like alcohol? Yes or no? You don't like, but you ate it, right? Sometimes when you are asked to answer only in yes or no, it is very difficult. I cite one example. In the court, once a lawyer asked one police officer, "Sir, have you stopped taking bribes nowadays?" Answer in yes or no. Stand up. What will you answer as police officer so that you don't get jail? Yes or no? Which one you will tell? Huh? You have to answer in yes or no. No. That means you were taking, just now you stopped. That much time, yes or no, you have to answer. So sometimes when you say yes or no, it's like that. So chronic alcoholism, it's a effect occurs among them who are very prone to alcohol abuse. When you drink, when anybody drinks too much of alcohol, what he skips? Meal. Right? So they sleep, next day morning they get up and again they wash their mouth with alcohol and they start the day with alcohol. Again sleep the day with alcohol, skipping meal. It goes on like that. And however meals they take, that is mostly fried, not a proper nutritious meal. So they lack what? Fresh leafy vegetables, cereals, pulses, which may contain thiamine. So in the long run, they suffer from thiamine deficiency. So what happens? They suffer from a disease called Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome is a mixture of two diseases, Wernicke's encephalopathy and Korsakoff's psychosis. Encephalopathy and psychosis. Okay, together they are called Wernicke-Korsakoff syndrome. They also suffer from peripheral neuritis or polyneuritis. Peripheral neuritis means numbness, tingling sensation in the extremity, numbness or tingling sensation in the extremity, shivering or trembling in the extremity. These are signs of peripheral neuritis. Wernicke-Korsakoff syndrome. Insufficient intake of impaired absorption of thiamine, loss of memory, apathy, rhythmical to and fro motion of eyeballs. Rhythmical to and fro motion of eyeballs. Mane? Anyone? Anyone? This has got a name. Bolbe? Anyone? Nystagmus. Nystagmus. What is that? If you ask the patient to follow the pen, okay, usually, সামনে দেখাচ্ছি ডিস্টার্বেন্সটা বুঝিয়ে যাবি face them. Usually, you look at my pen, okay, this tip. So, চোখগুলো বড় বড় কর. Now, look at her eyeballs, how it moves. Is smooth? Right? Now, if I replace her eyeball movement with this in a actual patient, then her eyeballs will move with the smooth movement of pen. Her eyeballs will move like this, jerky movements. This effect is called nystagmus. Correct? The pen will not move like that. The eyeball will fail to follow smoothly. See, mine is smooth, na? Why? Because I am not. What is it? Conic? Very good. You get good marks. You should always learn how to make people happy. That's what we are here for. Correct? You made me happy. Very good boy. Korsakoff psychosis, আমি ডিটেইলসে যাচ্ছি না, দরকার নেই. Wernicke's encephalopathy মনে রাখ. This is due to Wernicke's encephalopathy, nystagmus. Okay. Now we come to this one. Deficiency manifestation of thiamine. Beriberi. Beriberi. Three types of beriberi. Wet beriberi, dry beriberi, and infantile beriberi. Wet, dry, infantile. And remember, wet beriberi, death due to CVS failure, cardiovascular system. Dry beriberi, death due to CNS failure. Clear? In wet beriberi, there will be edema in the extremities. There will be congestive heart failure. Wet beriberi. Wet, more liquid, congestive heart failure. Dry beriberi, no liquid, no edema, but CNS is affected. Neurological system, neurological damage. Clear? What else? See, tachycardia and all this will follow when there is excess fluid accumulated in the CVS. Tachycardia will happen in galloping nerve, galloping pulse. In peripheral, in dry beriberi, we will have all neurological. This ataxic gait, a peculiar called drunken gait. Drunken gait. What is drunken gait? When you are driving late night, coming back from your friend's birthday party, driving yourself, and the party was a little high, you are also suddenly at the juncture of Park Street, you are welcomed by a couple of police fellows, traffic police, and they will ask you to step down and walk on a straight line. How you will walk? How you will walk will ascertain how much penalty you are going to give. If you walk straight, 0 penalty. If you cannot, 10,000. Right? So you cannot walk. So you will go like this. So drunken gait. But the patient suffering from this will walk like that without drinking a single drop of alcohol. Right? Which one you like? To walk with alcohol or to walk the same way without alcohol? Which one you like? See, there are many questions like yes or no. Fine. Infantile beriberi. The pivotal feature of infantile beriberi is soundless cry. Soundless cry. Like you are crying soundlessly. Come on, leave me, leave us from this class. It is soundless. Everyone speaking inside you. I can hear, but again, it is soundless hearing. I can't act. Sorry. So the soundless cry is due to lack of energy. Why? Because there is no carbohydrate metabolism. Usually, if the condition persists, the baby dies, the infant dies soon due to congestive heart failure. What do you mean by aphonia? Soundless cry. Aphonia, soundless cry. Baby will cry without sound. It's called aphonia. Let's go through, read it. Everything is given in your book. Note down the important points and try to make your own notes. Read that. Assimilate that. Prepare for examination. From very day, today. If you prepare from today for your examination, I guarantee you, you will never fail. Just see the results of your seniors in coming exams. It will be horrible. If you don't want to repeat that, please follow the way I say. I guarantee you will pass nicely without any hassle. Little effort you have to put, that's all. For sometimes, for the rest of this, for 6 months or so, or not 6 months, April, May, June, July, 4 months. You have only 4 months in your hand. Please forget everything within 4 months. And just remember, you have to pass. I tell you, it will be very difficult if you do not start from today. Now, today means from very day. You should start. You start doing, start following proper procedure, proper strategy. Make your own strategy. You are 150 students. I don't know how you behave, how you study, what is your liking, what is disliking. I don't know. Some people might like to study early morning, some people like to study late night, some people like to study only in the afternoon. I don't know. Don't follow my terms. Make your own terms. But whatever you do, please don't waste time. This time will never come back. After 6 months, still you will be young. You can leave and you enjoy your rest of your life. But after 6 months, these 6 months will never come back. You will fall behind for rest of the course. For this just 6 months. Please start studying from now. Don't make it compulsion, forceful compulsion to come and attend our class. No. When you attend our class, please go away, go back, taking something from the class. Something should enter into your head. You must get some benefit. The material topics have been well explained in many of the AI generated classes. Notes, doesn't matter from where you follow. But you must follow the classes. Why? Because we give you the guidelines. The vital guidelines. The AI will tell you what to read. And we will let you know what not to read. This is the difference. No one can take our place. No AI can take our place. The face-to-face conversation, no AI can take. AI will furnish the information. But remember, you have to assimilate, put it inside your brain. Then only you will get the benefit out of it. Make your brain work. Push it harder. Push it beyond the limit. You don't know, your brain does limitless activity. In the beginning, when you see this big book, you think, oh, I cannot remember the whole book. At the end of this course, you will see you have studied at least 5 times at that. How? Because your brain continuously, when you put more pressure in the brain, your brain extends. Understand? You put more pressure on your brain will not explode, it will extend. Nothing will explode. Nothing will explode within or outside your brain. Nothing. Your brain will function more efficiently. You will increase your brain's capacity. Causes of thiamine deficiency, দেখে নাও পয়েন্টস গুলো।